Hello guys, welcome to the Newzee. I'm back with the special news for you. N95 masks are flying off the conveyor belt at Protective Healthcare or PHG in Paterson, New Jersey, as the manufacturer ramps up production amid the Omicron variant surge of the coronavirus in the United States. The company's CEO Brian Wolin says demand is through the roof.
We are rapidly expanding. We're ramping up. We're working 24/7 at this particular time. We're hiring nonstop. We're flying in new machinery. We're ordering excess raw materials to be able to accommodate whatever that the country needs. We're here to support the United States, and we're thrilled that we're able to manufacture these critical pieces of PPE at this time.
The factory began producing N95 respirators in September 2020. These days, it's operating 24/7 to manufacture 70,000 N95 respirators per day. It plans to increase the numbers to 110,000 in the coming weeks, as demand from hospitals, distributors, and consumers heats up. N95 respirators filter at least 95% of airborne particles, both large and small. A surgical mask, by comparison, is designed to protect others against virus particles that are breathed out. There is growing concern that cloth masks do not provide sufficient protection against the Omicron variant.
Here's an N95 respirator, which is a flat fold respirator. The first thing you want to see is that it has head harnesses or head straps instead of ear loops. That's a clear sign that it's a NIOSH approved N95. You also want to see the word NIOSH in there as well. What we do to make this much more comfortable, we add a foam nose piece in, which gives comfort around the bridge of the nose. We have a very soft outer and inner layer, which is called spun bond. We use a triple spun bond. It gives the mask a tissue-like feel. And in the middle is the magic ingredient, which is called melt blown, which helps to filter out 95% of particulates at 0.3 microns.
A federal agency called the National Institute of Occupational Safety and Health, or NIOSH, regulates and approves N95 masks. Protective healthcare respirators are NIOSH certified. All of the respirators are batch tested before leaving the Paterson manufacturing facility and going out to sale.
It's very difficult to become a NIOSH-approved N95 respirator manufacturer. You have to go through a lot of quality procedures. All of the N95 respirators that leave here are batch tested. Nothing leaves our facility until a random sample of respirators are tested from each and every lot before they actually go out for sale to the general public. And 100% of all the respirators batch tested must pass 95% efficiency or higher.
The respirators are assembled in the USA using globally sourced materials. The manufacturer says that while it is not immune to the supply chain issues affecting global industries, it has ample raw materials at the moment. But costs have gone up and trucking is an issue.
We have been very fortunate that we have ample raw materials, which we were lucky enough to have sourced after Delta. But yes, supply chain is a major issue. We are looking to get more materials. It is taking longer to get them, the cost of those raw materials has gone up substantially. Trucking is an issue as well. Many of the even UPS drivers are out with Omicron, so they can only send us one truck in an evening, and we need two trucks to send out our respirators, so sometimes we have to wait an extra day. But supply chain is an issue, but we've been fortunate enough that it hasn't really hurt our industry at this time.
The Washington Post reported on Monday that the CDC is considering updating its mask guidance because of an increase in the number of Omicron-related coronavirus cases. The agency will likely advise people opt for the highly protective N95 or KN95 masks worn by healthcare personnel if they can do so consistently, the newspaper reported, citing an official close to the deliberations.
I've been saying since day one, if they could make these available to everyone on the planet, I personally believe that every problem that we had wouldn't be here at this particular time. Now, certainly, these weren't available in abundance back in 2020, but they are now. And I think it's fantastic that everybody should finally be wearing them. And, let's just stop this and move on.
COVID-19 infections in United States are at their peak with almost 800,000 new infections reported each day.
Hope you like this video. Please share it and also subscribe to my channel and press the bell icon for latest updates. Thank you.